PCOS or Polycystic Ovarian Syndrome on the Bella Society today, and because September is PCOS Awareness Month, that is why we like to educate all Malaysian women on what this condition is all about and whether or not there is a cure to this condition. And right now, infertility is sort of increasing in Malaysia, and some of it is caused by PCOS. And how many women suffer from this? We actually found out the numbers, and it is actually quite alarming. Have a look at this. So at least 30% of women in Malaysia who have some form of infertility is because of PCOS. And we're so fortunate today to have Dr. Lim Lei Jun, consultant obstetrician, gynecologist and fertility specialist from Sunfert International Fertility Centre here with us this morning. Good morning, doctor.
Morning,
Thanks for being here with us today.
Happy to be here.
Okay, so maybe we can start with PCOS. Tell us, what is PCOS?
Well, PCOS is a condition where women's hormone is out of balance. So that makes them do not ovulate on a regular basis. Well, ovulation is the release of an egg from the ovaries each month, and therefore giving you a regular periods. So when this does not happen, the periods become erratic. So they would have missed their periods, or they have very long cycles. This not only disrupts their period, it also affects their ability to get pregnant. Well, apart from this, they have other consequences, other health consequences also, such as they are more prone to become diabetic, more risk of being a hypertensive, higher cholesterol, and it increased some form of cancer risk as well, such as womb cancer.
Wow, okay, right. So other health risks connected to PCOS as well. Right. And I mean, most women come to you because they cannot have babies, and then they find out they have PCOS.
That's right.
Right?
Yeah.
So tell us about, okay, polycystic, it says cyst it has the word cyst in words. I mean, I've heard of cysts and fibroids in the uterus and in the ovaries and whatnot. Right. So how is this different from PCOS?
Okay. Now, those are other ovarian cysts. Now, in Polycystic Ovarian Syndrome, the ovaries are enlarged, each of them having more than 12 follicles. Now, follicles are essentially sac-containing eggs. They are actually immature eggs that fail to ovulate. So they appear such as cysts on the ovary. So they give us the picture of a multiple cysts on the ovary. Therefore, they acquire the name of polycystic ovaries.
Okay, so every month we have follicles in our ovaries.
That's right.
And then they will sort of keep the eggs until they are mature before releasing them, right? Into the uterus, into the fallopian tubes and into the uterus. That's what I understand. But when you have polycystic ovaries, it means that the eggs will not mature? Or are there too many eggs that are
they have
released
twice the number of eggs, but they are not being released. What happens is that in the normal cycle, a few eggs will start to mature, but only one become leader. And that one eventually ovulate, that means get released.
Yes.
Now, in women with PCOS, Polycystic Ovarian Syndrome, the hormones that trigger ovulation is out of balance. So that process of ovulation does not occur. Therefore, the cysts remain as immature eggs that has failed to be released.
So it's more of a hormonal imbalance that causes the ovaries to have multiple cysts.
That's right.
I see. Okay, so what is the difference between, like we were talking about polycystic ovaries, PCO, and Polycystic Ovarian Syndrome?
Yeah. Now, there's a stark difference. Polycystic ovaries are just an ultrasound description of how the ovaries appear. Basically, the ovaries appear enlarged, having more than 12 follicles in each of them. Whereas Polycystic Ovarian Syndrome is a clinical condition, wherein women who have this will exhibit 2 out of 3 following manifestations. First of all, they have irregular ovulation or even absent ovulation. Second of all, second of all, they have a raised male hormone. That means they may have excess of hair, facial hair, be it facial hair, or the hair on the chest, on the abdomen. They can have oily skin and acne skin, all right? And thirdly, when you do the ultrasound, we'll see many, many cysts on the ovary.
Okay, let's have a look at this visual between someone who has a normal ovary and someone with a polycystic ovary. Let's have a look at this visual. And maybe doctor can explain. So this is the...
Yes.
Actually, this is the treatment, right?
This is the treatment.
This is an enlarged ovary already.
That's right.
Okay.
This is a treatment, what we call laparoscopic ovarian drilling. It's part of the fertility treatment for women with PCOS in an attempt to help them to get pregnant.
Okay.
It does not correct the picture when you scan them later after the surgery. The ovaries may still appear polycystic.
Okay.
But then it corrects the hormonal imbalance, in a way restore ovulation, helping them to get pregnant on their own.
Okay, so this is one of the treatment that you sort of damage the ovaries so that the hormones will go back into balance.
That's right, in a controlled manner.
In a controlled manner.
That's right.
So once there's holes in your ovaries, how would your ovaries still function?
Yes, they will.
It will still release eggs?
Yes, they will. That's the purpose of getting the ovaries to release eggs. Yeah, because it's controlled damage. As you can see, there are very, very minor punctures.
Okay.
We don't overdo this.
Okay.
You cannot overdo this. Then you deplete the ovarian reserve.
Okay.
All right, so it's a balance. It's striking a balance between helping them to get back their hormonal balance and helping them to restore ovulation. This effect of the surgery is, however, temporary. It lasts up to a year. The aim of the surgery is only to help to become pregnant.
Okay.
All right.
So, what are the conditions a woman with PCOS must have for her to be able to, take this treatment, to take this drilling?
This is not the first-line treatment.
Okay.
All right. First-line treatment is, of course, lifestyle modification, weight management being the cornerstone of all management.
Okay.
All right. So that includes maintaining a healthy weight, a healthy diet, and regular exercises. Now, then we go on for some with very minor symptoms. That alone will help them to restore their period and go on to have a regular ovulation like the previous patient.
Yes.
All right.
Is it true that most women who are overweight and obese will suffer from PCOS?
Well, we will say that 2/3 of women with PCOS are overweight or obese.
Okay.
Right? There are lean PCOS too, but 2/3 of them are overweight.
So as long as you have these lifestyle changes, sometimes it will correct your hormonal imbalance.
Especially when you're, because it's a spectrum of disease, especially when you're at the mild end, well, with lifestyle modification alone, everything gets back to normal. Now, even if you are in the moderate or the severe end, lifestyle modification is still the cornerstone because it makes our treatment more effective.
Yes,
all right? So the first line would be lifestyle modification. Sometimes we give them fertility medications to help them to ovulate. Those are generally oral tablets. Like the previous patient, she has taken clomiphene. All right, this is a commonly prescribed medication to help the women to ovulate. So we'll try that first, only for women who do not respond to the first line management, and if only ovulation, that means absence of ovulation, is the sole cause of infertility, especially when they are young, then we would consider surgery such as laparoscopic ovarian drilling. Okay. All right.
If you have any questions at all for the doctor, you can give us a call right now. It's 03-5569-0349, okay? If you think you're suffering from PCOS or maybe you just have a burning question that you want to ask the doctor about your own infertility, you can give us a call right now. Okay, we actually have someone already on the line, Jessica from Penang. Good morning, Jessica.
Hi, good morning.
Morning.
Hi, doctor. I just want to mention I have PCOS and I was under metformin.
Right.
But somehow metformin I had side effects from metformin, so my doctor discontinued it, and now she's prescribed me something else. But somehow when since I've been diagnosed with PCOS,
you have been what? Sorry, Jessica.
Hello.
Hello.
Yeah. Sorry. Since I've been diagnosed with PCOS, I somehow realized that I'm always lethargic, very tired, and I have very bad mood swings.
Okay, doctor, do you have any questions
so
for Jessica?
Doctor, what can I do?
Well, apart from metformin, is there any medication that would help you to restore ovulation as part of your fertility treatment?
At the moment, not yet. My doctor said maybe she wants to prescribe some pills.
Right. Yeah, metformin is a common drug that we use because, as you know, PCOS has insulin resistance. That means their body do not utilize insulin effectively and they have excess of insulin. So this can lead on to a host of other problems. Now, the use of metformin improves this condition, but metformin being a medication, it has its own side effects. Most of them are able to deal with it, but some of them they suffer from the side effects, they are not able to continue on. Now, we commonly use this as an adjunct to our fertility medication in an attempt to improve ovulation. Therefore, if you are not able to tolerate metformin, you should discuss with your doctor. I'm sure that he or she will advise you other medications such as clomiphene, tamoxifen or Femara in an attempt to help you to restore ovulation. Now, failing that, then we go to the second line, which include certain injections, fertility injections, in the treatment, part of the treatment process of IUI or IVF, or considering laparoscopic ovarian drilling, given no other cause of infertility being present.
All right. Did you get that, Jessica?
Okay. All right.
Thank you so much. So thank you so much for the call. So actually, you would say that the medication is what's causing Jessica to have the mood swings and the...
Well, metformin doesn't really cause mood swings, but it can cause you to have a lot of gastrointestinal side effects such as nausea, vomiting, loss of appetite, diarrhea in some, and abdominal cramping.
I see.
Now, these are the common side effects. The good thing about it is that most of them go away after taking it for a while. But for some who develop hives or who become very tired, excessive sweating, cold, clammy skin, they need to watch out for conditions like lactic acidosis while you're on metformin.
Okay.
So talk to your doctor if you feel unwell.
I see. Okay. Right. So how early can you diagnose someone, a girl with PCOS?
Unfortunately, this is a hormonal condition. You can only, they are born with it, but you cannot diagnose it not only after puberty.
Okay.
All right. Most of them can be diagnosed in their teenage. Some of them may present in their 20s or even early 30s. Right.
Okay. How do you diagnose a person
commonly,
with PCOS?
Irregular periods. They commonly come to me with irregular periods, inability to conceive. Some of them actually unexplained weight gain, facial hair or acne problems.
Okay.
Sometimes we get referrals through endocrinologists when they found out about diabetes in a young person and having other menstrual irregularities, then we come to a diagnosis of having polycystic ovarian syndrome.
Okay. Like I said earlier, a lot of people only come to you when they try to get pregnant and they can't.
Yes.
And then after that, they get diagnosed with PCOS. Yes. But like you said earlier, there are a lot of other health implications that comes with having PCOS. For example, diabetes.
Right.
Right? What other health implications are there?
High blood pressure, hypercholesterolemia, and these, if left untreated, can lead on to heart problems, and also not forgetting womb cancer.
Womb cancer.
Womb cancer.
Well, it's quite serious actually. So
yeah, in a small group of them, especially if they have very few periods, I'm talking about fewer than 4 periods in a year. That in the long run, we're talking about 10, 15 years down the line, having that infrequent periods, your lining can be thickened, and in some, this can lead on to cancerous change.
Oh, wow. Okay, we have another caller on the line. It's Karen from PJ. Good morning, Karen. Good morning. Oh, I think we've lost Karen there.
Yeah.
It's okay. So it is very important to actually diagnose PCOS earlier on.
It is.
Even before you want to try to get pregnant.
It is.
Okay.
Yes.
So, so person's diagnosed with PCOS and she's come to you and says that, you know, I want to have a baby.
Yes.
What would you ask her to do first?
Well, we'll first assess her severity of her symptoms. And of course, the years of trying is very important. Her age is very important.
How many years of trying? Should you try naturally first?
Women that are more than 35, after half year of trying, they should come to us.
Okay.
Below 35, probably a year of trying.
Okay.
All right? But if you already know you have infrequent periods, probably even in your early 30s, you want to come earlier because you already know there could be, you are suspecting a problem. You don't have to wait for 1 year, all right? Because time is an essence in initiating any treatment. Right, so after assessing the severity of their symptoms and also assessing the other causes of infertility that could be present and address them, we will ask them to control, maintain a healthy weight, and then see if she needs any fertility medications and start off with some first-line therapy such as fertility pills and then go on to take it for about 3 to 6 months to see if they are able to ovulate regularly. If that fails, then we consider second-line treatment, which can include IUI or IVF or laparoscopic ovarian drilling.
Okay, a bit more invasive.
That's right.
Okay, all right, now we have another caller on the line. We have Sarah. Good morning, Sarah.
Hello, morning.
Morning. Do you have a question for the doctor, Sarah?
Yes. Actually, I want to ask, what is cost for the treatment?
What is the cost of the treatment?
Yeah.
For
all right.
which treatment?
For which treatment, Sarah?
The
surgery?
One that just now, earlier?
The surgery, the drilling?
Yes, the drilling.
Okay.
Well, the drilling is essentially a keyhole surgery that requires general anesthesia. It can be done as a daycare procedure. Well, in a tertiary private setting, it can cost anything between 10 to 12K.
10 to 12K, okay.
That's right.
All right. Does that answer your question, Sarah?
Yep.
Thank you so much for your call.
Okay, thank you.
Okay, before we go on to all the treatments and whatnot, actually, I have a burning question. What is the cause of PCOS? How do you get PCOS?
There's actually unknown. The cause is unknown, but many experts...
It's unknown,
Yeah,
okay.
it's unknown. Many experts believe that it could be hereditary.
Okay.
All right? Women are just born that way. But in these days, I think lifestyle has a triggering factor as well.
Like
right?
you said, 2/3 of women who are overweight,
That's right.
most probably might have PCOS.
Well, it's the other way
The
around.
other way around.
2/3 of women with PCOS are overweight. Or obese.
Oh,
Yes,
I see.
yes.
Okay, so if you control your lifestyle, control your diet,
right.
sometimes it will help with the hormone balance. So
right.
it's known, PCOS is actually known as something that is treatable, but there is currently no cure to it.
True.
Is that true?
There's currently no cure to PCOS, but fortunately, the treatment to manage their symptoms and to prevent their long-term health consequences are quite readily available.
Okay, and what are the percentage now of women with PCOS getting pregnant naturally, without IUI, without IVF?
Perhaps we don't have a statistics because they don't come to us because if they get pregnant naturally. But those that come with very mild symptoms, if they are very motivated to control their lifestyle, to maintain a healthy weight, yes, they can get pregnant on their own.
Okay.
All right? But some, I mean, easier said than done to lose weight. Sometimes we need to, help them along the way, like giving them medications. Now, with medication and certain medical intervention and bit of lifestyle modification, many have gone on to have a pregnancy.
All right. Okay, we're going to go for a short break right now, but coming back, we're going to talk about how lifestyle modification can help you if you suffer from PCOS.
Hi, my name is Nurain Mustafa. I'm 27 years old and I am recently diagnosed with PCOS.
Nurain Mustafa had no idea what PCOS is prior to being diagnosed and only knew that it was normal for women to suffer from hormone imbalance.
I was devastated, frustrated, and I feel like this world is so unfair.
Her visits to few hospitals for doctor appointments further informed her regarding her hormone imbalance issues.
To be honest, I was quite overwhelmed because if I knew earlier I was diagnosed with PCOS, then I could probably equip myself with the knowledge about PCOS. But it is what it is, so I think I take it from them.
After Ayn was diagnosed with PCOS in the middle of July recently, she did some research about the issue, and from what she has learned, she needs to change her lifestyle.
I am an avid rice eater. I love rice so much, like all Malaysian does, and I love to eat chicken. So based on my reading, so I actually changed my lifestyle, especially about my intakes of foods lah.
Taking the principle slowly but surely, currently Ayn is having a fish diet plan and started to do yoga and more workouts. Of course, things will be fun when you get someone else involved, and in this case, it's Ayn's husband, Khairul Azmir. Ayn and Khairul met each other when they were studying at UITM in 2005. It would be a wish for any married couple like Ayn and Khairul to have a family.
To be honest, it is quite frustrating to know at first because of this is what we have planned for quite some time, to have a family together, to have kids. But as I see, as what she has said before, this is something that we can't control. Whatever we can do is we can, it's up to us. Whatever we can control, we do.
Having children will surely bring joy to parents, and family planning is a matter that is never easy.
We do have a pillow talk before we sleep. So what we should do next, what's the next step to be taken, the kind of diet that we're going to have, kind of lifestyle that we're going to have. So there's some fight between we have some arguments, of course, but it really affects our marriage. I will still be strong with her, and I will go and support her in whatever she do.
As for Ain's mother, Nur Hayati has been very supportive and wants the best for her daughter.
Buat dulu apa yang doktor arahkan untuk dibuat, macam kurangkan berat badan, jalani hidup secara sihat. Kalau mungkin selepas 10 tahun, mungkinlah akan fikir benda-benda lain untuk ambil anak angkat.
Don't worry, I'll always be with you. We'll go together. We'll go together through this, through whatever it has to take, whatever you have to eat, whatever you have to do. We'll go through this together. Don't worry.
And of course, having a supportive family who goes through this with you all the way helps as well. And I like what the husband says, do what you can to help yourself in your chances to overcome PCOS. And that's why we have the manager of dietetics and food services from Ramsay Sime Darby Health Care here with us, Nurul Aziah Musa. Nurul Azia. Hi Nurul, good morning. Along with Dr. Lim as well as Hani, back on the couch with us to talk about PCOS. First of all, let's talk about diet. So how can lifestyle change help us overcome PCOS?
For patients with PCOS, they need to understand that apart from taking the medication prescribed by a physician, of course, it's very important to understand the importance of healthy diet. Okay, so usually once a patient is being referred to a dietitian, first thing we need to assess in terms of if the patients happen to be either overweight or obese, let's make it a realistic plan, you know, how much weight loss that we are planning. But I think in general, 5 to 10% probably will do good, Dr. Lim. Then from there, we focus on making sure that the patients understand carbohydrate, because as per what Dr. Lim was saying earlier, insulin resistance happens to be quite common. So we need to educate the patients that you can have carbohydrate, right? But focus on a complex carbohydrate versus, for example, things like you know, rice, or maybe we suggest instead of white rice, yes, you go for brown rice, or instead of white bread, you can take a healthier versions like wholemeal bread or whole grain bread, you know, and cut back on refined sugar, things like, you know, gula putih, gula merah, your carbonated drinks, your refined snacks, so on and so forth.
So it doesn't mean that they have to cut out carbs and sugars
completely
from their diet.
It's basically, I think, it's a bit unfair for them, and for long term, it's something that I do not think is sustainable, you see. So it's important to understand that, to cut it back gradually, and to focus more on fiber, Belinda? And fiber comes from your fruits and your vegetables, all right? When you cut down your carbohydrate, these fruits and vegetables do give some form of variety in the diet, and vegetables, basically we are emphasizing, you know, between 3 to 5 servings in a day, and patients need to understand as well that fruits can be taken.
Yes.
Fruits
because we all think that fruits have a high, you know, high sugar level as well. So can we actually have fruits, especially with even diabetic patients? Can they have fruits?
Can.
They can.
It's definitely a must to have fruits in your daily diet. But patients need to be educated in terms of the serving size and the frequency.
I see. Okay, well, how would that serving size and the frequency differ from, let's say, a healthy person?
Okay, probably we need to focus on the portion. They're not supposed to take it as much as normal people, especially if you are down with diabetic. But to completely take out fruits from your daily diet is a big no-no, where it's a part of a balanced diet. But it is basically advisable to take fruits on its own rather than juicing, because you're going to lose the fiber.
All right.
That's one thing that we need to understand.
All right. So let's go to Hani. Is this how you managed to get pregnant naturally?
No.
No? You had to, I mean, of course you had lifestyle change as well, and you went on an Atkins diet, like
Atkins
you said
diet,
earlier.
Because
Did you cut out fruits completely and sugars?
Yeah, for the first level, Atkins have 4 fasa. And then for the first phase, kita kena cut down semua karbohidrat. Karbohidrat, sugar, karbohidrat, semua yang orang kata boleh menaikkan berat badan kita cepat lah. Yang paling penting kita adalah jangan makan processed food.
Okay.
Processed food tu memang sangat-sangat jahat bagi kita. Bagi kita yang suffer from this kan, PCOS dan orang-orang yang obesity, processed food is sangat jahat bagi kita. Yes, kalau kita berjaya cut semua tu, InsyaAllah kita punya berat boleh turun dengan cepat.
Yeah, when we say processed foods, it's things in a can,
yes,
in a box, junk food,
the drink,
carbonated drinks and all that. So eat whole foods and fruits.
Yeah, fresh fruit, fresh fruit. Yeah.
So how did you eventually get pregnant naturally? Can you share with us your story?
Okay, after 8 years married. Okay. Lepas doktor kata, okay honey, you kena diet, then you see me again. Then I terjumpa diet Atkins.
Okay.
After that, 7, masa tu berat I 80 kg. Lepas 7 months, berat I turun 59 kg.
Wow, so from 80 kilos to 59 kilos in 7 months.
The most, benda yang paling best adalah Atkins adalah kita tak perlu nak kontrol sangat makan kita. Just makan fresh fruit, tak payah makan ubat, then period kita akan jadi normal balik.
Okay. So Atkins diet is actually just a protein-based diet, right? Nurul, what do you say about people with PCOS taking on the Atkins diet like honey?
So what's the opinion of the dietitian? So as a dietitian, basically any of the dietitians, I do not think that we, sorry honey, you know, we're not really endorsing
we already know that
Atkins high protein diet. However, to a certain extent, I agree to disagree that, you know, it helps.
It helps.
Yeah, but probably we've got to look at each individual patient. You know, for someone younger, probably taking a high protein diet wouldn't affect you as much. Yeah, but compared to someone older with probably diabetes per se, you know, so that diet probably can lead to another condition if it's being practiced for some time. Yes, for too long. Yeah.
But because we know if you take a high protein diet, you have to exercise, right? Otherwise, you will also gain weight.
And depending, you know, if you go on a high protein diet, but you fry the proteins and you deep fry it, you know, it will defeat the purpose as well. So it's back to basic where you need to cut back your fat, you know, and make it a balance throughout. And one thing that patients with PCOS, they tend to have a lower metabolic rate. Right? And with that lower metabolic rate, sometimes, despite putting effort on diet, they still find it hard to lose weight. So the suggestion that usually I will give out to patients is basically to have regular meal patterns, and that's very, very important to make sure that you will maintain your metabolic rate. And by
regular meal patterns, you mean by having breakfast, lunch, and dinner at the almost the same time?
Basically, breakfast, lunch, and dinner, and you probably can have small, frequent meals in between, but it's not like big frequent meals, then you tend to put on weight. So you need to know the carbohydrate distribution. And breakfast is the most important meal of the day. Never ever skip breakfast, because if you skip breakfast, then your metabolic rate will go down. And go on a proper lunch, and of course early and light dinner. And make sure that you've got fruits and vegetables throughout. Then, you know, you're going to have a balanced diet.
It sounds like a balanced meal already, but how easily accessible is it to Malaysian women? Let's talk more about breakfast later on, but for now, we're going to go for a short break. Coming back, we have these ladies back on with us, and we'll be answering more questions about PCOS. Welcome back to Bella Society. We're talking about how we can conquer PCOS and take back our femininity and our womanhood and overcome infertility. And we have here with us Nurul, Dr. Lim, as well as Hani, all experts in the field. Let's go to Dr. Lim now. How many of your patients have actually, successfully become pregnant from just lifestyle change without any drugs?
Well, I don't have an exact figure per se, but I do have experience with these few women who are motivated enough to lose weight and become pregnant on their own. Now, weight loss, when you tell them to lose weight, is often they looked at you with a blank stare and said, yeah, doctor, you're right, easier said than done.
Yeah.
But you need to get across to them the importance of losing weight. And that weight loss, I'm not trying to ask them to get back to 50 kilo from 80. Well, her kind of weight loss is remarkable, but you stress to them, you just need to lose 5 to 10%. And that drives them, okay? Just 5 to 10%.
And that will help.
That will help.
With their chances.
Yeah, I tell them, look here, now you're having period only once in every 3 months. Now with that, let's say you're 80 kilo, just by losing 5 to 8 kilos, you probably won't see me anymore. You don't have to see me anymore. Your periods get back on track and increase your odds of getting pregnant on your own, all right? Even without, say if you still fail to get pregnant by, say, half a year or 1 year, you come back to see me, it'll make our treatment more effective. So that's very important. That doesn't end there. When you become pregnant with a more healthy weight, you have less risk of miscarriages, less risk of diabetes, less risk of hypertension during pregnancy, and overall, that translates to a healthy pregnancy, healthy baby. And that's what we all want.
All right. Like we said earlier, diet and exercise, and Nurul, you were saying that breakfast is the most important meal of the day. So as Malaysian, what can you recommend? Maybe you can give us a sample menu of someone who's trying to lose weight because of PCOS, what to take for breakfast, lunch, and dinner.
Okay, so probably it will be very hard to avoid our nasi lemak,
So we can still have nasi lemak?
Yes. By all means, you can have nasi lemak, Belinda, by all means. But again...
You're a very kind dietitian, I think. I don't know. I've never met a dietitian who tells me that I can still have nasi lemak if I want to lose weight.
It's fine, because I think when you go too extreme, it's kind of very hard to get compliance, Dr. Lim? So I usually would suggest to patients, okay, you probably need to cut back your frequency. If you used to have nasi lemak every other day, of course, we need to cut it down probably once a week. And when you go for that particular nasi lemak, for example, okay, probably you need to cut back on your rice portioning, since it's carbs, Then you probably can ask for more kangkung celor, that blanched kangkung, or probably more timun, cucumber. And then you reduce your sambal, per se, and probably you choose half a hard-boiled egg instead of fried eggs. And we remove the yolk, probably just the egg white. So this is how you sort of like remodify your nasi lemak. And of course, a healthier one can always be like noodle soup, or probably a toast in the morning, or probably, your whole grain cereals with your low-fat milk, and, chapati instead of roti canai. We go mama. So that will be a healthier version of breakfast. And of course, when it comes to lunch, probably like I would agree with Hani to cut back on your processed food, cut down on your fast food. But focus more on a balanced diet where you take your carbohydrate or probably your noodles, and then make sure that, imagine a plate, right? In your plate, you divide it into quarter. Quarter would be your rice, and quarter probably would be your protein. And half of the plate you fill up with lots of vegetables. Different color vegetables will give you different nutrients.
So that will be the same for dinner as well.
Right. Then probably one tips. You take your fruit first before you take your main meal.
A lot of people say that actually, but I mean, when we talk about fruits, it's like pencuci mulut, right? It's like dessert.
The other way
so
around.
After.
You take your fruit first, because you makan buah dulu, then you rasa kenyang.
Then you won't stuff yourself with other stuff.
That's another trick that usually I would suggest to my patient. So you can do that.
All right. Thank you so much, Nurul. Any last word, Dr. Lim, for maybe our PCOS sufferers out there?
Well, don't get upset because you have been diagnosed with PCOS. Now, it's quite common. About 20% of reproductive age group women are affected by this condition. Now, it's very treatable condition, so come forth and be motivated to, even if you do not wish to become pregnant, you say that is not my concern, but you know, think about a more healthy lifestyle later on in the rest of your life.
Okay, and Hani, any last words to all your peers out there?
Untuk yang dah lama berusaha untuk mendapatkan zuriat, macam saya 9 tahun, ada cara dia.
Where there's a will, there's a way, right?
Allah ada sentiasa bersama kita. Kita ada Tuhan.
And believe in God and trust. All right, thank you so much, ladies, for that insight. I've learned so much more about PCOS, and I hope all of you have as well. And if you need more, of course, you can Google it. There's lots of information out there on the web for you to actually, you know, equip yourself with all this knowledge so you know how to handle it. Tomorrow, I will be back with a bunch of men on Bella Mars, and we'll be talking about men and their wealth. How do men measure and manage their wealth? All that and more coming tomorrow, so remember to stay tuned. Thank you so much for watching.